Hello, everybody. Welcome in. Thank you for downloading, listening, watching, however you're taking this in. We appreciate you being here. Another fantastic episode of the Strength for Your Purpose podcast coming your way. We continue this awesome string of interviews we've gotten going here at the start of 2022, taking a little bit of everything from all these different fields as we always do, and bringing it full circle to help you strengthen your true purpose in life. So really excited about this one. I had the pleasure of being on his podcast just a few weeks ago, which is the Ortho Eval Pal podcast. So if you are in the medical field at all listening to this, I think it's a great resource, especially for physical therapists. But even if you're not, you can learn a lot about what physical therapy can do and the types of things that we know and can help people figure out. So without further ado, my guest today is Paul Marquis. Paul is a 1992 graduate of the University of New England and vice president of clinical operations at County Physical Therapy. Paul specializes in the evaluation and treatment of patients with orthopedic, sports, and work-related injuries. His passion for educating students and medical providers prompted him to establish Maine Orthopedic Seminars, where he offers a number of live and downloadable CME courses for medical providers with a focus on orthopedics. From there, he started Ortho Eval Pal, for which he is the podcast host, online coach, and mentor. Paul also has an entrepreneurial spirit and proceeded to develop the Easy Slant calf stretcher and founded Easy Slant LLC. Paul enjoys spending time with his wife, Beth, and children, Michael and Gabrielle. Paul also likes kayaking, hiking, working on his tree farm, and creating content for his YouTube channel. Paul, thank you so much for joining me on the podcast.
Phil, it's a true pleasure to be here. I'll tell you, I've really enjoyed listening to your podcast and your outreach, and how you're going about doing it is just absolutely spectacular. And I've been at this for a little bit longer than you have, and I know what kind of work it takes, and for you to do it with a young family and all that, I really kudos to you. It's really great. But thanks for having me on.
Well, thank you very much. I appreciate that coming from you, and I just. Similar to you, I just like getting the message out to people, and that's definitely part of what I wanted to chat with you about tonight, because as I said at the top, what you put out there is just a great resource. It's a great resource for consumers a little bit too. Some of it might be a little bit jargony, industry talk that they might not necessarily fully understand all of, but a big part of my mission is just trying to get good information out to people that they might not realize can be a service that can be delivered by that type of a provider, or whatever the case might be. And I have a really big passion for that in PT, because people see us as, we help people after a surgery or walk their grandmother up and down the hallway at the nursing home. They don't always know that we can be a great resource for pain and daily dysfunction. So I kind of want to start there. Talk to me a little bit, Paul, about sort of your career trajectory and how it's gotten to a point where you're now passionate about educating other people about how to be better at helping people.
Yeah. Well, I really have to say I was really, really lucky that I had great mentors when I first started off. Mentors as a student, on my clinicals, great teachers when I went to college, and then jumping into the orthopedic world. My boss now, Mark Rossingall, just really hammered it to me and really tested me a lot. And I could have, just turned around and said, I don't want to deal with this, but it was tough sometimes. And I pushed hard through it. I did a lot of work on my own. And then as that got better, it became more rewarding. And then I just wanted to learn more and more and more, and just basically wanted to keep pushing. And as I did this and started to feel a little more confident in my skills, not only with my evaluation skills, but my treatment skills, I started to identify these issues sometimes that maybe were missed elsewhere. And we picked up on it, saved somebody maybe a lot of money, a lot of time. They're in a lot of pain for a long time. We've seen, you've seen it, people who've had, back pain and had that treated with x-rays, MRIs, injections, manipulation, whatever. And then they walk into your clinic and you identify that they have a severely arthritic hip. And that has been causing all of their back pain. They have a hip replacement, the back pain goes away. And It took us 5 minutes to identify that.
Yeah.
And had we caught them early, we could have saved all that time and that misery and that loss of quality of life. And that's really what brought me to Ortho Eval Pal, is that I wanted to be able to teach younger therapists and younger medical providers. It's really not just for PTs, but these younger medical providers to get a good diagnosis, because number one, that's the number one reason why people don't get better. You know, hit that diagnosis, hit that nail on the head right away.
Yeah.
Cut out a lot of this extra diagnostic imaging that oftentimes gets done for nothing or for the wrong problem.
Yeah.
And, you know, and get to the source of it. So you're not just treating symptoms, but you start with the cause. And then, you know, you realign the wheels on the tire, on the car, that the tires are wearing off, and you kind of fix the problem right away. And people appreciate that. They really, you know, what I've learned is giving people that little bit of extra is super, super important. And that may be just, you know, they don't know what to do next, or they don't know if they should contact their physician, or if they, you know, and we help do that and give them that little extra assistance. And I think that makes a huge difference. And as I got older and into, you know, I'm into my 29th year of being a therapist, almost 30 years, I feel like I need to instill this on other people, you know, and as they've done studies that showed that it took like 10 years for people to feel super confident evaluating people and giving a good treatment plan and hitting everything just perfectly and feeling totally comfortable with that. And I believe that, because I'm learning all the time. And what I have, and I feel very, very comfortable with, I don't mind moving on to others so that they can just kind of come out of the box and really push, because we have so much to offer on so many different levels. And I think, you know, that's really why I'm doing what I'm doing. I just feel like we need to pass this on and hopefully help others feel more comfortable, you know, when they're evaluating patients and getting people better.
Yeah, no, you're exactly right. I think the way the trajectory of the entire healthcare field has gone has kind of fed into the instant gratification that we like in our society in general. And people like to have that image. They like to have, you know, these few extra things done, and, you know, kind of the dartboard approach. But it's pretty frustrating when you spend all that time and money to do it and nothing's changed at all. And you get to the place that it ultimately helps the true root cause of that problem, and then you actually get better. It's like, geez, I wish I would have done this like 3 or 4 months ago. I could have spent three or four months less in pain and dealt with this from the get-go. But yeah, on top of that, the other thing that I really liked what you said is having an effect on the way people see our field by just making the people in our field better and more confident at what we're doing, because we've seen a big shift in our field as not primary care providers. We're not MDs, but in that direct access model where people are able to get to us as a first line of defense for these things, which we just talked about is super beneficial. But at the same token, we need to make sure our field is so well equipped that we aren't questioning things, that we're making good, effective decisions for these people right out of the gate. Because if we can't do that, people's confidence level in what we're able to do as a direct access primary care provider of some sort is going to go down, and our field isn't going to be utilized to its full capacity.
Absolutely. And, you know, I love using this direct access. It's super important. I never used to do it all that much. You know, you always had this issue. Well, we probably should have insurance, make sure that insurance does this and insurance does that and all that. But really, what has insurance done for us? I mean, it's there, and it can be helpful, but I'm going to tell you what, there's nothing that frustrates me more than me looking or seeing a patient and identifying they have severe, let's say, nerve root compression, and they need surgery. Like, some people just need to have surgery. They need to have it decompressed.
Sure.
And then the insurance company says, well, you have to fail 6 weeks of physical therapy.
Yeah.
But here's 6 visits.
Right.
You know, and what are you going to do in that time? And they're, you know, we're being controlled, and I'm not liking it. And the other thing that I don't like is that, you know, I don't even have my master's in physical therapy. I graduated with a bachelor's in physical therapy and in science and physical therapy.
Yeah.
And I learned a lot, through experience and through making mistakes, and then and studying hard. And I still study hard, and I still, research stuff. And then, I went to a master's program, went to a DPT program. And I think that, as DPTs, we need to be able to get out there and say, yeah, we're DPTs. We've been studying for 7 years. We know this stuff, and it's not just another class. It's just not just it really, the PT profession has really grown a lot. And I think that we need to act like that, and we need to, press along and lead. And it's frustrating that, that I don't think sometimes we're taken very seriously. And probably because there are other professions out there that just lobby better than we do.
Yeah.
But I think we need to, number one, stand up for ourselves. I think we need to prove ourselves and continue to lead and push hard. And that requires a little bit of work. That can't be done just by sitting on our haunches and, getting comfortable. But, doing what you can and giving a little extra is super important. And, I can't stress that enough. And I know I might get a little extreme sometimes, and I have JOSPT magazines sitting on my nightstand and things like that, and I'm really always looking up new stuff and better ways to get people better. But that's been my passion and my fire. And I know some people, they run out of that fuel for the fire sometimes, because it's very frustrating, because we work and we work and we work and we have more and more restrictions. We can be seeing more patients, but the reimbursement is less.
Right.
And so here we are, we're working harder, and it's just like this anvil on our shoulders holding us down.
Yeah.
But I think it's important that anybody in the medical profession, they find, something else that might fuel their fire. It may be in the same type of profession. I chose giving lectures, giving live courses, and, inventing products and doing things like that, and becoming entrepreneurial. And that all kind of works around physical therapy. But I'm also a tree farmer. That's like, I love that. I get out, I work hard, and it's fresh air, and I just love doing that. But finding those little things that make you happy, is super important, and will continue to make you a better provider. And I think on top of that, it doesn't matter how many years we have under our belts, we're always learning. And I think collaboration is key. There are, I know a lot about orthopedics, but if somebody came into the clinic and had a vertigo issue, I wouldn't even know where to start. And I'll be the first to say that. But now, my daughter's in her 5th year of school, and PT school, and, she's studying BPPV and all this stuff that we never even touched when we were in college. And, I'm kind of jealous, but there are certain things that you may not be strong in, but that's what we go to our coworkers for, or other colleagues. And, that collaboration, I think, is super important, so that you don't feel like you need to bear that all on yourself. So that's kind of my thing. It's, it can be tough, and I think it can be a struggle, and it can be like that in any medical profession, especially going through COVID. Has been quite a challenge in many different ways, not just physically, but psychologically. And I think we just have to be there for each other, even more now than we ever have.
Yeah. No, you said a ton there, Paul, that I'm all excited about this conversation now, even more so than I was, because you hit multiple nails on the head there. You're right. First and foremost, we definitely need to take good care of ourselves, because, people that get into the healthcare professions got into those professions to help other people. If you don't care about other people, you're not in healthcare. And not to say that people that aren't in healthcare don't care about other people, but the level of selflessness that's there in people that are really passionate about their job in healthcare, they strive to help and serve other people. But we've got to be better ourselves in order to do that at the highest level. If we're thinking about our own aches and pains we've got going on, or we aren't fulfilled in some way from some aspect of our job or our life or whatnot, that's totally going to spill over.
Absolutely.
into our care. The next thing I'll say there is you're right. Our field has come a long way, and instilling that lifelong learning, I think, is a big part of it. You were very lucky in your early career to have that instilled in you from your mentors, which is incredible. I had that same fortune, and part of that transition to a doctorate in physical therapy is creating that curiosity and that drive to always be open to learning new things and just relearning old things and getting better at them. And I think what's helped our field a ton is people like yourself who have done that through their whole career, DPT or not, helping the DPTs get more competent in things they just haven't seen yet. And hopefully the folks that you did go to PT school with will catch on and continue to do that too, because, I think from what my own personal experience, there's a lot of folks that came into the field and you did, and there's kind of two ends of the spectrum. They're the people that are doing and are still doing what you do, and they're the people that are still doing it the way that it was done when they first graduated PT school. And I think that's where some of that disparity is. And if a new graduate PT with a doctorate works for or with someone that still is doing things the way they did it back when they graduated PT school 30 years ago, that's going to trickle on, right? They're going to,
right.
So we need that combination of new blood with all that new information coming out of school with that tried and true experience and lifelong learning to change the way things are, so that more insurance companies, that example you gave, I love that in that example, the insurance company at least wanted PT first, but in the situation, that doesn't make a whole lot of sense either, does it? When we as the
right.
PT and the provider say, hey, I'm actually not the person for this person. So all of those worlds need to be better, but I think it starts with us and our perception in the public eye, so that when things don't make sense from an insurance perspective, we can navigate around that, and people will put their trust in what we can do to help them.
Yeah, I think we need to be able to pivot at the right time.
Yeah.
And, we have to make big decisions.
Yeah.
People don't understand the decisions we need to make with folks sometimes. And, if you have somebody with a fresh rotator cuff repair and you need to get them moving, there's really no room to screw up here and make a mistake and re-tear that cuff, or a quad repair or an ACL reconstruction. They're expensive surgeries. These doctors do very technical work, and we do too. They do. They put these people back together, and it's up to us to not mess that up and to avoid complications.
Right.
So that we can move them forward, through this inevitable healing process. We need to be able to guide them in the right way. You can guide them into stagnancy, or you can help to push them along. And I think that one of the things that we lack in our schooling is the power of positive thinking, and, being goal-oriented, and helping to drive people, but in a very structured way. And I always go back to, and I've talked about this in other podcasts. My grandmother was 98 years old, and she was giving exercise classes at 92, and she continued to exercise almost till she passed. She would walk on a regular basis, and she was very French speaking, and she'd say, "Si tu grouilles pas, tu rouilles," which means if you don't move, you're going to rust.
Yeah.
And my parents always instilled with me, you walk tall, you walk with purpose, you speak to people, you're polite. And I think we've lost a little bit of that. And I think that we need to get back to it. And I think it comes down to, customer service. It doesn't take a lot to give good customer service. And for those of you who are listening, there's a nice little YouTube tidbit. It's called The Science of Persuasion. And it's so simple. And it actually has, some it alludes to the medical profession a little bit in it. So if you get a chance to listen to it, it's called The Science of Persuasion. It's really good, 11 minutes or so, and gives you a lot of great information and insight. And some of you may already have this, intrinsically built into you to help these people and to do a little bit more. But I think, we've got to keep doing what we're doing. We've helped a lot of people.
Yeah.
We've seen a lot of people, and I think we need to collaborate and communicate a lot more just to make sure that we stay at the top of our game.
For sure. Yeah, and I think that's real important in today's environment. We're talking about talked a little bit about the direct access model of care, which affords both the provider and the client true one-on-one care, that because of these changes in insurance where they put more limits on us and pay us less and make us jump through all these hoops, that we still have to do a great job taking care of these people. And some clinics have done a great job not putting these types of things in place, but a lot of places you see are having to see 2, 3, 4 people at a time, and people get better, but do they get as better as they could get? That's up for debate sometimes, I think. But that's where most of the jobs are within our field too. So anyone listening to this that might be a new grad PT or thinking about it, going to PT school, or if Paul's daughter's listening in her 5th year of PT school, don't get discouraged. You can still be very good at what you do and have an impact on people. We just have to work on having that impact within the environment that we're in, and giving everything we can to these people and making ourselves better. But I do think, and I'd actually be a little interested on your take on this, Paul. I think push is going to come to shove sooner or later where that direct access model of care is going to be much more widespread before we get changes in the insurance industry that actually allow us to do what we do best, uninhibited by hoops and red tape. And I really think that's our near future.
I think there has to be some sort of and I'm not very good with statistics and numbers, but I think there should be some sort of a study out there that follows the direct access model and calculates the cost of evaluation, early access, early treatment, and then measures how well a person gets back to their quality of life. That might be getting back to work or back to sports or back to, taking care of their children or whatever it might be. I would love to see the numbers on that, because I probably see 4, 5, 6 people a week direct access. They call up and they say, just hurt myself, wondering if I can come in. And so we bring them in, we do a quick evaluation, and evaluations don't have to be an hour. Okay. After you get better and you've seen thousands and thousands and tens of thousands of people,
right,
and you see these things and you know them and you can get through them quickly, you can easily evaluate them in a short amount of time. You can get them directed. Do you need conservative treatment? Is this something that is surgically urgent? Maybe your family, your PCP can help you out with this. What direction do they go in? So it's not just about treatment. I think that we get so caught up in evaluation and treatment, and we're taught in school that we cannot diagnose people. Well, first of all, when a patient is sent to us with, and this is like, really, I'm not doing this to slam anybody, because we have our specialties. Like my specialty is orthopedics. If somebody comes into the clinic and they have like belly pain, I'm like, go see your primary care. I have no idea what's going on with you, So our specialty, mine is orthopedic. So if somebody comes in, we're able to really effectively, take care of that. And we think that it's just about evaluation and treatment, but it's not. It's about evaluation and management.
Yeah.
How do you manage that patient? So if somebody comes in with a cervical herniated disc and they have radiating pain down the arm, we think that we need to treat that and treat that and treat that and treat that. And like, I've seen patients who have gone elsewhere and been treated for 50, 60 visits, and there's been no change.
Yeah.
And then they come see us and they have little faith in physical therapy. So I think that we need to make sure that, we make these decisions, we manage the patient. And if you get through a reasonable amount of time and you're not having improvement, it's time to make a change. You need to reassess what you're doing and reevaluate the patient. But I'd love to see a study that shows it costs this much for this patient to get better through direct access. And in this amount of time, versus this process over here, which we are doing right now, which is basically wait and wait and wait and wait. And then we know that the people who are out of work longer have a lower chance of getting back to work.
Yeah.
Same with athletes, same with anybody else. So
Yeah.
the chronic situations are much harder to treat than those acute ones. So
Sure.
I think we need to be evaluating. We need to be diagnosing. There's
Yep.
nothing wrong with that. We're good at that. That's what
Yep.
we do. And in managing those people.
Yeah, you're right. And that the first point I'll make there on what you said is the whole PTs can't diagnose thing is an insurance regulation. That is not a regulation that we as PTs in our field have put on ourselves. We are competent in diagnosing the problem. We can tell you whether you may or may not have a rotator cuff without an MRI. We can tell you, is it a disc? Is it the joint? Is it the muscle in your back that's causing your nerve pain without an MRI? We can tell you the level that's at without an MRI. And we can come up with effective conservative treatment if that's the most appropriate case for you. So that's kind of one point to make. And the second is they have done, I don't think they're calling it direct access studies, but they have looked at a get PT first model for back pain. And most of those measures that you just mentioned, cost savings, amount of time, and overall function, people's overall function and how well that sustains. And getting PT first, they compared getting PT first, they compared imaging and seeing a specialist. And then I think there was also might've been a group that saw a specialist and got injections before they got PT. So all three groups got PT. That one group might've never gotten PT. And there was two groups with PT, but what they found was the get PT first model saved somewhere in like the $2,000 to $3,000 range out of their own pocket. This isn't insurance reimbursement. This is money out of their own pocket. Got better weeks earlier than the people who had to go through a few hoops before they got to PT. And their quality of life, like their functional scores, improved and lasted much longer than the other two groups did. So for specific diagnoses, they've already done that a little bit, and they found some very significant improvements in that arena. And back pain, I think, is one of the things that direct access makes some of the most sense for, because there's a little bit of jargon out there that if you have acute back pain of a week or so, that you shouldn't go see anybody for it, really. You could just kind of handle it on its own. And I really think that those people could make sure that acute back pain doesn't come back if they get a little bit of that evaluation and management, as you said. I might not be able to treat you and immediately take that pain away, but let's show you how to at least calm it down and get you moving better, and show you some strategies to make sure that this acute flare of back pain doesn't recur every 2 to 3 months or whatever the case might be.
I concur 100%. Yeah. It's as simple as, things as simple as how to get into and out of bed, how to get out of a chair. All these little things that can put you at high risk or complicate or exacerbate that problem. We have, that's what we do, is we kind of think ahead, and we think, and then as you get older, like me, and you experience some of these things yourself, that's where the knowledge comes, and then you can carry that on to others. And so you learn a lot from that. But yeah, I totally agree with you. It's more than just categorizing people. You can take 100 people with back pain and they all need to be managed differently. Yeah. And there are so many factors. There are physical factors, there are work factors, there are home factors, there are psychological factors, and they all have to be managed just a little bit differently. Yeah. Some people like to be pushed, some people need to be pushed. And, I totally agree with you. And I think that we do a good job at kind of sifting that out and teasing all that stuff out.
For sure. And the other thing I'll throw into that example you just gave is all 100 of those people could have the exact same diagnosis of back pain, could have the same structure causing their back pain, whether it be a disc herniation or arthritis or muscle spasm or whatever the case might be. You could see 100 people with a disc herniation in their L5, and all of them would have to be treated differently in one way or another, right?
Absolutely.
Progressed faster, progressed slower, started with a different set of exercises than someone else. Every single time it's the same on paper, it's going to be different in the process, but the end result is often the same, which is we can be pretty successfully resolving it conservatively. So
absolutely. Yeah, absolutely.
That's the great news. Awesome. Yeah. Well, Before we get to the last two questions I have for you, Paul, I want to just give you an opportunity to tell the folks out there where they can find out a little bit more about Ortho Eval Pal and Easy Slant. So you can talk a little bit about Easy Slant, what that is, and also Ortho Eval Pal, and how can people find you?
Yeah, so sure. So, the reason I started Easy Slant LLC was out of frustration. Basically, I've seen thousands of plantar fasciitis patients. I just a tremendous number of plantar fasciitis patients and metatarsalgia and all these foot issues. And I was getting frustrated because I didn't like the big slant boards. They were not very portable. We know through the studies that you need to be stretching 3 to 4 times a day to get a good effective gastrocsoleus stretch. It needs to be for at least 30 seconds, 5 times each time. So, about 15 to 20 times a day. And people had these big boards. They weren't very portable. They weren't very adjustable. So they might've been stuck with one incline, or sometimes, the little styrofoam ones were not steep enough. People would slide off of those. And I'm like, enough is enough. I wanted to create something that was portable. So, and, really, really strong and adjustable. So that's where I came up with the idea of Easy Slant. And we just started prototyping a little bit. Then we got into 3D printing some of this stuff.
Nice.
And then we developed kind of like a Cadillac model, and we have some professional sports teams using them right now. And we have a website and whatnot. And really, it's a product that is, it has 4 different levels. And, when you look at the research, there's 90+% of people with foot and ankle problems have a tight calf. And it's a very big contributor to problems like knee pain, hip pain, and back pain. And so, that's why I did it. We're looking at getting into a lighter model, also like a plastic model, something that has a better price point for folks. And, but yeah, it's been a passion of mine. I've really enjoyed doing that. And then, along with that, I started Ortho Eval Pal, where I'm podcasting. I think I just did about an hour ago, episode 228, and started a few years back, and really just, had a hard time starting with that because I'm really computer illiterate. So I just really kind of plugged at it a little bit, listened to a lot of podcasts about podcasting, and got into that. And I like to educate. So it really, it really kind of fell into what I wanted to do. And then I started a YouTube channel. And that we started about, I don't know, maybe 11 years ago. It's grown to over 450 videos. And I think I just hit 9.5 million views. And that has been really, really fun. And what I've done with that is probably about 3/4 of it are actual patients with actual problems. So what I've done is I've tagged my name and Ortho Eval Pal to all of these diagnoses. So if people are looking for, sesamoiditis, they just had to put in Paul Marquis sesamoiditis into Google, and it pulls right up. And so it's been quite a resource. I've been hearing from people all around the world, and it's been kind of fun to listen to some of the comments and all the people that we've been able to help, especially in these countries that don't have access to healthcare. And so we give little tidbits of information for both the general public, but also for the medical provider. And so we can help both at the same time.
That's fantastic. Great products. We'll make sure we link all that stuff in the show notes so that people can check that out. And I knew you did Easy Slant because I've talked with our mutual friend Chris Krause about it a few times. But professional sports teams, that's awesome. Congratulations, Paul. That's fantastic.
Thanks.
Yeah.
And if anybody has any questions too, they can always get in touch with me at paul@orthoevalpal.com. And that's easy. Or I'm on Instagram or Facebook. They can message me also. That'd be fine.
Perfect. Awesome. Great stuff. So the final 2 questions I have for you here, Paul. Number 1 is, what is your definition of strength?
I think grit has to be tied to strength. If there's physical strength, but there's the ability to push through and have grit. And I think that there are people that are intrinsically and naturally strong. And then there are those who may not be. There are your people who are genetically endowed to bench press 350 pounds, and there are those who are not. But those who are not and are willing to try, that's my definition of strong. Okay.
Yeah.
It's about that willingness to achieve a goal, to be better. And, I think if you can make yourself better, then you can help other people better. And so, I'd probably say that's my definition of strength.
That's
It
awesome.
may be kind of a roundabout, not a
No.
straightforward, these are the, actin and myosin filaments, pulling together at, I physiology was never a strong suit of mine, but,
Yeah. No, that's
I
fantastic.
think, I see a lot of people, I admire the people who come in the most, who may not have everything, they may have, psychological stress, physical stress, maybe they have financial stress, and they have a hard time, but, they come in and they're determined, and they see something, they see some little light, they felt better for a certain amount of time, or maybe they were able to communicate with other people that were in pain and were having problems, and that kind of pulls them out. And then you see them intrinsically drive themselves to do more and to be stronger and to be better. And, you see that. And, that's why I go to work. That's why I get up in the morning. I've never had a day where I didn't feel like going to work. Never. I go to work. I guess I wouldn't call it work because it's fun to me.
That's
I
awesome.
thoroughly enjoy it. And, it's those types of people who really make it for me.
Yeah, that's fantastic. Great answer. I agree completely. And the last question, you actually answered probably a little part of this here, but what is your true purpose in life, Paul?
I've always, I don't know, I've always been kind of a really humble person. When I was a little kid, I was always super quiet, the quietest kid in class. Always, you can ask any of my teachers.
Yeah.
I've treated half of them now, and and they'll always tell people in the clinic that, oh, he was so quiet and he was, everything. And I always kind of looked at myself kind of passively as, I don't have anything to offer. Like certain people out there, they're presidents, and they're, they maybe they were the major league manager of a baseball team or something like that, and they contribute in this sense, and their name is very popular and everything is out there. So I don't see myself like that. But one of the reasons I've done Ortho Eval Pal and Maine Orthopedic seminars and all this stuff is because I just want to, my purpose is to pass this on to my daughter, pass this on to other people out there who want to help other people get better. And I've always been truly passionate about what I do. And I think that if I leave this world tomorrow, I'll have left them with something, and it's a little bit of knowledge and hopefully the ability to help other people.
That's fantastic. Well, keep bringing that knowledge, Paul. I know I really appreciate it as a PT. I love what you do for us as physical therapists, what you do to help your clients and your patients get better. And you're doing so much for our profession. And there are a lot of people in Maine, and I know you know this because you know all the same people I do in this realm, but there are a lot of darn good people in Maine that are contributing to this profession. And it makes me very proud as a native Mainer, just like yourself, to see that. So thank you very much, Paul. I really appreciate what you do for our profession and what you do to help people. And you are for sure fulfilling your true purpose. So I really appreciate it.
Well, it's my pleasure. And thank you so much for having me on the show today. I really had fun, and we should do this more often.
Of course. I totally agree, Paul. I'm sure we will. There's a lot of what we talked about. We could make like a whole separate episode. So we'll definitely hit on some of this stuff again for sure.
Sure.
But for everyone out there, please check out Paul's stuff below. Like I said, whether you are an orthopedic surgeon, a physical therapist, a doctor, a nurse, or just someone who wants to learn a little bit more about how PT can help you, Paul's got plenty of great stuff out there for you. Thank you all so much for listening. If you found as much value out of this episode as I did, please be a friend and tell a friend. Share this info with someone that you know, love, and respect, who will find value in it as well. Can't thank you all enough for downloading, listening, watching, however you're getting this podcast. I appreciate it. Go make it a great week, and we'll see you back here next time on the Strength for Your Purpose podcast.